Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, what are the differences between the non-ischemic central retinal vein occlusion and we also have ischemic central retinal vein occlusions. So if you see the differences between non-ischemic and ischemic central retinal vein occlusion, non-ischemic occurs in 75 to 80% of the cases, whereas ischemic occurs in 20 to 25% of cases of central retinal venous occlusion. The non-ischemic will have visual acuity better than 6 by 60, whereas in ischemic central retinal vein occlusion, the visual acuity will be worse than 6 by 60. Then, relative afferent pupillary defect is either slight or it is nil in non-ischemic central retinal vein occlusion, whereas relative afferent pupillary defect is markedly present in ischemic central retinal vein occlusion. Visual field defect. Visual field defect is actually rare in non-ischemic central retinal vein occlusion. The visual field defect is common in ischemic central retinal vein occlusion. Fundus shows less hemorrhages and it shows less cotton wool spots in non-ischemic central retinal venous occlusion, whereas fundus shows more or extensive hemorrhages are seen in the fundus, and there is also more cotton wool spots are also seen in the ischemic central retinal venous occlusion. Then fundus fluorescent angiography shows good perfusion in non-ischemic central retinal venous occlusion, whereas non-perfusion or poor perfusion can be seen. Non-perfusion of more than 10 disc diopters can be seen in ischemic central retinal venous occlusion. Electroretinography is normal in non-ischemic central retinal venous occlusion, whereas electroretinography is actually reduced B wave amplitude is seen on ischemic central retinal venous occlusion. Prognosis is almost 50% with 6 by 60 or better, whereas prognosis of ischemic central retinal venous occlusion is that 60% of the patients will progress to rubeosis iridis, or the patient might progress to neovascular glaucoma in 60% of the patients.
thank you and thank you for watching.